The next one is cyst, and this refers in this case to bladder. Cyst literally means sac. So a bladder is a type of sac. A bladder is kind of like a bag that collects urine. Urinary bladder is the root cyst. And the first word I pronounce as cystoscopy. I have heard it cystoscopy, but that bugs me. If your professor tells you to use that, use that. But to me, it is cystoscopy. So you have cis, tos, ca, p. So I have the root, cyst, and the suffix scopy. I may have used this as another root, I'm not sure, but remember it means to examine or observe. So cystoscopy is a procedure used to examine the inside of the urinary bladder. A scope is inserted into the ureter, the tube that runs into the bladder. I'm sorry, not the ureter, that runs to the kidneys. The urethra, the tube that carries urine from the bladder to the outside. So cystoscopy involves inserting a scope through that tube to examine the inside of the bladder. And then we have cystitis. Cyst, actually, I think it breaks like this. I'm not sure. Cystitis. You have that very common itis out there. That means inflammation. You see why I showed you the suffixes first, because you can use those over and over again. And then, of course, cyst is bladder. So cystitis is inflammation of the urinary bladder, possibly diagnosed by cystoscopy.